I was actually at work and she called me and said, I need you to get to the hospital as soon as possible. There was an issue with one of the babies. He had hypoplastic left heart syndrome. His heart was not fully developed, and that the left side of his heart had not grown. In a few hours, we would be transported over to Driscoll here in Corpus Christi.
When they got over here, they told us, he had suffered a stroke.
And the chances were not good that he would make it. Whatever happened, and, with quality of life, we were going to take care of him.
What stands out to me the most about the care he received is the fact that you feel like he's the only patient they have. Every time they would come into the room, the nurses, the doctors, everybody, they knew him by name. They knew us. They knew if we had gone to eat breakfast, if we had a place to stay, they helped us. And it seems like that's something small, but you're away from home. And those things, they matter. They matter a lot.
Every time I see Daniel, every time I see his parents, it gives me joy. To see him succeeding at school, to see him dressing up on Halloween. In fact, last year he dressed up as a cardiac surgeon because that's what he wants to be. It gives me joy when I see his dad wearing a t-shirt with everybody's picture on from the Heart Center.
If someone were to ask me, who in this world do you owe the most to? You're number one. You completed our family. You allowed him to have a life that a lot of doctors thought he would not have.
We'll never give up on the baby like him, and this is the reason. This is the reason. It's the reason, isn't it?
Okay.
Patient outcomes for the Norwood procedure have been really tremendous here in the Driscoll Heart Center. And currently we have, according to the STS Congenital Heart Database, some of the best outcomes in the country. It takes a really big team of dedicated people to look after children with hypoplastic left heart syndrome. I don't think we ever assume that we're the best. I don't think we ever think, hey, we've got this down. We don't have that approach. The whole culture is, how can we do something better? What can we do better for the patient? What's the best thing to do for this patient? And there's no destination if you have that goal.
Our team comes in and tries to do better than the day before. We actively look at our results, we look at our outcomes, and that helps guide us in the right direction, I think. Seamless communication amongst multiple subspecialties is important to be able to deliver the kind of care that we strive for here at Driscoll. This requires us all, I think, putting the patient first.
Our whole approach is dealing with our patients and our families to make sure that we have the compassion that they need to get the care, especially in our heart center. I think our team is very well diverse. We are able to communicate with the physicians, with our CV surgeons right away without getting any pushback.
Our Quality Improvement Committee has developed what is called our Discover team, and that stands for Detailed Investigation into Serious Cardiac or Vascular Response. And so what this team does is it meets in real time so that it can capture that real-time feedback from frontline staff after any sort of serious event that could affect our patient outcomes.
Driscoll was able to achieve a 98.5% survival rate purely by dedication, commitment, and absolute focus on our patients. We analyze everything. We look at everything from the drips to medication administration to process of an event and to learn from that. And from that, for example, we have dramatically diminished our ECMOs after cardiac arrest, for example. Learning from these moments has allowed us to really get the outstanding outcomes that we've been able to demonstrate.
Driscoll Heart Center serves one of the largest geographical areas and one of the most medically underserved areas in the entire country.
This requires cardiologists throughout the area, well placed to afford patients to get care local to home, and a well-resourced and well-trained transport team that can move the patients when it's necessary.
We have 6 planes every day that take providers from here into the community. We have 3 planes for transport, for bringing patients back to us. When I think of the huge geographical area that our patients come from, it makes me think more than what does this patient have, what is their diagnosis. It makes me think deliberately about the family. It makes me think about their social situation. It makes me think that they're a long way from home and how important it is for us not just to look after the patient, not just to treat the heart problem, but to treat the whole family and to look after everybody involved in the patient's care.
I mean, this honestly was our second home. Like, we were here for that whole year. Dr. Langley, just any questions, any fears that we had, he would help us. He calmed us through those, and we were just so grateful to have him as a surgeon of Daniel.
Most people that meet them, they're like, so which one's the one that was in the hospital? And they don't know. They don't, because he does everything that his brother does. For us, it's special because he can grow up and he can tell his story. And that's what we want for him.
I think in years to come, I want to leave a legacy that is founded on quality and founded on a culture that is determined to continue to do the best for children with congenital heart disease.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.